Thank you for joining us. So before the break, we were talking about sadness and grief during the times of the Prophet, and we're going to continue with that. Nemo, were there any other prophets that went through sadness and grief?
Specifically, I'd like to reflect back to Prophet Yaqub alayhi salam, and the type of grief that he went through is profoundly expressed in Surah Al-Yusuf because of his love of Nabi Yusuf and alayhi salam, and the distancing that happened between the two of them, and how much he cried for years until his eyes became white, and in some instances it's even said that he became blind over the grief. And so this is an intense experience that Prophet ﷺ went through.
Prophet Yaqub, you mean?
Yeah, I mean the Prophet Yaqub alayhi salam. Another instance that is also profound to me is the instance of the Prophet ﷺ. I mean, we as Muslims have an year that's dedicated to Am al-Huzn, the year of sadness for the Prophet when he lost, he went through the boycott, and after that he lost both his uncle and his wife, Khadija radiallahu anha. And these are just two of the most extreme examples that I can give that our most beloved or our role models have gone through.
And how they dealt with it is quite remarkable, subhanallah. Are there any other scholars who were there in after the death of the Prophet ﷺ, who told us about psychology or who did any work in psychology?
One of the scholars who has really pioneered in this work as well is Ibn Sina. I mean, a lot of people know him as the head of medical work.
Father of medicine.
The father of medicine, absolutely, the father of medicine. And so he's the first person to talk about psychosis and delusions and hallucinations, and to actually be able to create medications for this, and to also classify it as a different category from other illnesses, because in the current again knowledge that we have of psychosis is that it is it's very comorbid with other mental illnesses such as schizophrenia and bipolar. But then he was able to classify it as a disorder on its own and express it vividly. He did some good job with that. And these are things that we are still discovering and learning from. But yeah.
It's quite interesting. Relearning, I think it's the word, because it's information that has been there even before we had Sigmund Freud and the early fathers of psychology.
Carl Jung, Sigmund Freud.
Yeah, from a philosophical perspective. Were there any institutions that were dedicated to mental health in the Islamic era?
I mean, currently, most people, when they're asked when was the first medical institution or psychiatric institution built, they'll talk about the 19th century. They'll talk about it being in the Western world. But a lot of studies and a lot of discoveries have been done in the Muslim world, and we've just come to find out that the first psychiatric center or institute was built in Baghdad, and that's in Iraq. And so this was a center of holistic medication and healing. And so what was being done in the centers is that most people who are going through psychological disturbances were brought there not to be refined or not to be put in uniforms or restrained, but they were taken there for like they were taken there with kindness and understanding. And so these institutions would not even employ people who are not able to conform to the attributes of kindness and compassion and empathy. And so Islam has really like built this and has put a standard for us. But then we need to be able to, you know, get back our legacy and build from that sense. Yeah.
It's quite interesting. You said something about they were built in towns. Is there any specific reason why they were built?
The psychiatric centers were built in towns to follow the sunnah of the Prophet, because Prophet ﷺ taught us that we should be able to visit the sick and we should not be isolating the sick. And so these psychiatric centers were built in towns so that it was easily accessible for the mass population and for the Muslim society to go and visit the sick and make sure that they do not feel alone, right? And the centers also had very good ethics, and they were following ethics of the Prophet, back to being considerate, being following the rules of being ethical, and much more. Honestly, if I started talking about these institutions, I think it would take me an entire episode on its own.
Yeah. I appreciate that now we are, again, like I said, relearning our history and our heritage and things that we are responsible for, and the kind of amazing contributions that we've done in not just every field, but specifically mental health, which is amazing. So now that we know there was back information on mental health, and especially right now with the stigma that people have about mental health, mental wellness, and the mental health techniques, and I'm not saying this refuting the fact that some of the concepts of mental health do not go in line with Islam. We're very aware of those that don't go in line, and we have alternatives for that. My question is, what is the way forward for us as mental health practitioners, as people who are aware of the mental health and would like to create that awareness? What next?
First of all, it's again gaining the knowledge and understanding, because the more we understand about our, like, the importance, the ethics Islam has and how it relates to mental health, it becomes easy to, you know, have the two in line and not cross our boundaries with our deen. But then the fact that we are able to, and our deen actually encourages us to find new information and to put ourselves out there and keep on learning and discover more about ourselves and other human beings and what works for us. It's really important to, first of all, get knowledge. Yeah, and the Prophet ﷺ mentions that finding knowledge is actually it's wajib. Right. It's a necessity for every man and woman who's Muslim, right? Yeah. I mean, that is the first aspect. Gain knowledge. Do not limit yourself. Islam is not limiting. Islam is very much open to anyone and everyone. So come on, understand the deen and understand the secular knowledge as well. Yeah.
And because then it's something that I asked even before the break, when we talk about, because the society right now, a lot of people are dealing with anxiety and grief and depression, sadness, and it's something that I asked before the break. I feel like also the religion has very many solutions for us. There are many hadiths and verses, and one of my favorite verses of the Quran is, if you are thankful, I will give you more. And it's actually when contentment and lack thereof, contentment, is actually one of the reasons of sadness.
Absolutely.
Would you tell us a bit more about
Absolutely. This takes me back to something, a quote that I read by, again, Abu Zayd al-Balkhi, the scholar of the first Islamic scholar who taught us about psychotherapy. And he talks about different ways to treat sadness and grief. And the first aspect he talks about is cognitive behavioral therapy, which is very modern currently, and which we, in the secular world, people have discovered it in the 19th century, but this guy discovered it in the 8th century. And he talks about talking to counselors, and he talks about talking to people who are, well equipped with counseling and behavioral therapy. And he also talks about internally healing. So what he calls the external healing is the cognitive behavioral therapy. So the internal healing, he talks about understanding yourself, understanding where your sadness comes from, and healing yourself, and basically listening to yourself, and awareness, basically. And the third aspect he talks about is positivity. And so, which is a concept that, again, modern psychology has been coming up with, something we call like positive therapy. But he came to realize this in the 8th century, where he talks about positivity, and he says the importance of positivity is that you can maintain it and have it, so you can store the positivity for yourself, and later on use it in case of an emergency. So in case of you suddenly go through grief, or you become sad over anything else, you can use your stored positivity, and it can help you reflect in your current dealing with the negative experience you're having.
So does the reflection then include reflecting on what I have?
Absolutely.
Reflecting on the whatever it is. I mean, I could be going through something, but then there's something positive about. And for me, why I was asking about contentment is, as it being one of the reasons of sadness, is contentment is not, it's something like, it's a by the way for us, right? And we don't really practice contentment as much as we should. So apart from positivity, contentment, how else can we deal with sadness?
I think, again, I'll go back to seeing what you have, contentment. And how can contentment be achieved when you're sad is when you remember that there's always two sides to a coin, right? I mean, in as much as you're going through what you're going through currently, there's a different side to things that you might not be able to see it. And there is no experience that you go through that does not prepare you for a different experience, or does not ease your later on experience. And it's hard to see through that when you're going through the sadness, or you're going through the grief. And so for me, I particularly think it's important to let yourself be in the moment, and be present with yourself, and allow yourself to sit with the sadness at times. And I feel like most of the times we try to fight these emotions, and you're so eager to get past through it that you're not able to even experience it and see the importance, or sometimes it might not feel important in that situation, but you have to be able to let yourself to sit with it and experience it, so that you don't have to fight through the emotion. And that makes it easier to experience it. And so later on, when you get into a different emotional state, you can pass through even more smoothly.
Yeah. I love that. It just reminds me of a quote: what you go through, you grow through. Thank you so much, Nemo, for being with us. Inshallah, we would love to hear from you. Send us your feedback. We will see you in the next episode. Assalamu alaikum.